Thank you, Mr Speaker. I do move that this House calls on the McGowan Government to prioritise regional healthcare funding and services, including palliative care, in the 2019-20 state budget. And we move this motion, Mr Speaker, once more because there have been some very mean and heartless decisions by this state government since coming to power in 2017. Decisions that are impacting on the ability of ordinary, everyday citizens in our state to access reasonable healthcare services that are close to their homes. And I don't think that that is an unreasonable expectation when we are talking about areas of the state that generate a significant amount of the state's bottom line and contribute to the well-being of the entire state and indeed nation, that they should be able to access reasonable healthcare services. Decisions like this and those that have been made in the first 2 years of this state government show that this government's priorities are not to provide essential services like healthcare, education. In fact, we can only assume from the decisions that they've made that it is Metronet, Metronet and Metronet. And it is at the expense of everything else. It is at the expense of everything else, including these essential services. So our members on this side will outline some of those decisions and how they've impacted the communities that we represent, and why there is an opportunity here for this minister and this government to rectify some of those appalling decisions that they've made over the last 2 years in relation to regional health services. We move this motion because there are more and more stories emerging from regional WA, and the member for North West Central will talk to you about one that is particularly distressing from his electorate in Carnarvon, and something that I would test every member in this House not to be affected by the things that are happening to very senior members of our community, because they simply cannot stay or access the services they deserve close to their home. We don't think there is the health system here in Western Australia will receive the funding that it needs. We hope that we are proved wrong. Minister, it is your government's record. It's there for everyone to see. You've responded to questions that we've asked in this place again and again in relation to seeking assurances that places like Laverton will have the funding that was so meanly ripped from them at the beginning of your tenure replaced back in this budget. Now is your chance to rectify that and to prove that you are a minister and a government that truly governs for all Western Australians, not just those that live in the metropolitan area. I want to explain why we think that the Labor government has no commitment to regional health. Because, Mr Speaker, in 2 years of budgets, decisions to prioritise rail over health, cuts to projects that were committed to by the previous government, and there's been no indication that that funding will be returned. And so those communities are left languishing, wondering whether or not they will receive the attention that they deserve, that they will need to make alternate decisions in terms of when they get to a stage of their life, when we're talking about aged care services, as to whether or not they do stay in those communities and contribute to them. By May 2018, so this is last year, not even this year, there's a whole another 12 months that we could include in these decisions, this government had removed funding from the budget for Tom Price Hospital, Meekatharra Hospital, Mount Magnet Nursing Post, Paraburdoo Nursing Post, the Turquoise Coast Health Initiative, the Northwest Health Initiative, the Carnarvon Aged Care, which was part of the Northwest Initiative, the Laverton Hospital, the Newman Hospital project, which was spruiked by the member for Pilbara, who told his community earlier this year that tenders would be let by the end of 2019 and construction would commence in 2020. We were interested to hear that in terms of listening to the radio in our electorates. We came in here and tested it with the minister, and the minister said, "Sorry, I cannot confirm what the member has said. It is subject to what's happening in terms of our budget deliberations," and there was certainly absolutely no assurances in relation to the renal chairs or the renal services that had been promised by this government, in addition to the Newman Hospital project. So when asked in Parliament, the minister stated it was a longer-term project and one that is subject to budget deliberations. He could not confirm the timeline that the member for Pilbara had told his community earlier this year. So there's something awry here. because there's definitely members on that side of the House in regional Western Australia that are feeling the pain because their communities are asking why this money is not forthcoming, but they are not translating it into making sure that this Cabinet is making it a priority to go forward. Some explanation, Minister, is required here. It's been 6 years since you committed to building the Newman Hospital. That was a commitment when you were in opposition. And 2 years since you promised the renal dialysis services for Newman patients, and you've delivered neither. So it's clear that the member for Pilbara spoke out of turn. And for the record, our government, the Liberal National previous government, committed almost $60 million to convert that very tired and existing Newman Hospital into a fit-for-purpose modern service. And it would be nearing completion now, mid-2019, had we been returned. There's a very clear distinction about what you get when you've got a Liberal National government in charge of essential services delivery. Essential services delivery. Be very careful, member, because there are members of our community that do not have access to what you would consider the most basic of services. This is a serious issue. A serious issue. And it's your government that ripped it from the budget. It's your government that ripped it.
Members, I'll hear this in silence.
Thank you, Mr Speaker. They are still waiting, those members of that community, along with all the others that I listed just then and many more, for this government to replace the funding or at least provide a commitment that there will be an indication that there will be dollars forthcoming. We don't believe that is the case because the evidence to date is that when there is additional money coming into this state, it is delivered directly into Metronet. And we've seen that from the sale of PEXA, where we had $185 million coming into the State Treasury. The Treasurer then announced 100% of that would be going into the Metronet project. Minister, I'd be very interested to know if that galled you, as you had a list that I've just read, probably much longer, given some of the challenges we're facing in the metropolitan area as well, to see that all go to Metronet when you are trying as a minister to deliver an essential service in a government that clearly is clearly not listening. We've had 2 years of this government, and I think my colleagues in the National Party, when we saw the Getting Things Done document that you tabled last week and published, that there is, in fact, a list of health projects. And you, as the Minister for Health, and your colleagues have been to many openings. When we went through those lists, they were all projects started by this previous government, funded by the previous government, put on the table, prioritised by the Nationals and the Liberal Party in government. That was our commitment to regional health. You have been the beneficiary of turning up and cutting the ribbons, but there's actually been no solid dollars put into the budget for services like this for the communities that you so cruelly removed that project funding for, and it's not good enough. So things like opening the Karratha Health Campus, funded and delivered by the previous government, developing Merredin and Narrogin Health Campus, funded and delivered by the previous government, Carnarvon Hospital, funded and exactly. There's a whole list of them, included in the Getting Things Done, committed to, funded by us, and there are a number of projects that have been ripped out of that were part of those forward programs that no longer exist. Your dubious claim to fame in regional WA is that you have removed funding from the budget for health services rather than deliver it. And Minister, we've talked about the Laverton Hospital again and again, and I know the member for North West Central will cover it off. But how do you reconcile leaving Laverton off the list for funding when a government report from 2013, bearing in mind that we had committed to this, outlines in black and white just how dire the state of this building is? I mean, you only have to go and look at it, but then it's written in black and white in a report. Disabled bathrooms, not compliant with code. Patient showers, not compliant with code. Public toilets, staff toilets, children's bathrooms. Dirty and clean utility, morgue holding, laundry, kitchen, patient's bathroom, consulting rooms, treatment rooms, single wards, not compliant to code. How do you reckon those people feel when they turn up to the emergency department or require they're scared. And the staff are scared, Mr Speaker. The staff are scared. They're doing an amazing job, but they are scared. It is unacceptable and it is unconscionable that these third world conditions exist when amounts like $185 million and the other funding that is being poured into a project like Metronet, which is a black hole, we cannot and do not understand how much that's going to cost this state, instead of actually trying to deal with some of these essential services. Minister, you will no doubt speak to the fact that you've initiated the Sustainable Health Review. We're 2 years into that, and about curbing the expenditure of the Health Department. Your comments the other day that funding for the Laverton Hospital was a luxury that this government could not afford have been noted in the community. And I'm not misquoting, that was directly from the answer that you provided us.
Absolutely misquoting.
I'm not misquoting, it's directly from Hansard the other day when we asked you a question that you said, we do not have the luxury of providing all of these services. It is not.
To misrepresent the truth.
It is not. Absolutely
Minister.
not.
We expect this from the National Party. We get it all the
Minister.
time.
Minister.
The truth.
So we put on record today,
Minister, I call the order for the first time.
that if there is no priority given to regional health in this upcoming budget, some services and infrastructure will crumble beyond repair. And quite honestly, Mr Speaker, that is what we suspected had been happening when we came to government in 2008. We suspected that there had been services under the previous Labor government that had been let to go so far that the only decision the Health Department and the government of the day could have made was to shut them down. And we actually set about and put significant funding into the budget to ensure that not only did they have the infrastructure, but it made the Department of Health and the government of the day think about how they would change the service delivery models to meet the modern day needs of regional Western Australians. Without that, without those hospitals, without those nursing posts, without that investment into infrastructure like IT for telehealth, it is simply too easy for Treasury boffins to advise Cabinet ministers looking for dollars to spread across a stretched system to say it's easier not to have that service because there's not that many people out there. And that is exactly what we came to government in 2008 to face. That is what, in the first 2 years of this government, regional Western Australians in the areas I've outlined, and there are many more, have faced again. So, Minister, I look forward to your answer. I look forward to your members explaining why, if you cannot vote with us on this motion, you will not be providing a regional focus for health essential services in regional Western Australia in the upstate upcoming budget. Quality healthcare under your government has been found wanting in regional Western Australia. This is your opportunity to set the record straight.